cardiovascular stress test, they are using treadmill bicycle exercise with ECG and blood pressure monitoring. Pharmacology stress testing, established after exercise testing, is a diagnostic procedure in which cardiovascular stress induced by pharmacologic agents is demonstrated in patients with decreased functional capacity or in patients who cannot exercise. Treadmill stress testing is indicated for diagnosis and prognosis of cardiovascular diseases. A physician may recommend an exercise stress test to diagnose coronary artery disease, diagnose a possible heart-related cause of symptoms such as chest pain, shortness of breath, dyspnea, or lightheadedness, to determine a safe level of exercise, to check the effectiveness of procedures done to improve coronary artery circulation in patients with coronary artery disease, to predict risk of dangerous heart-related conditions such as heart attack. What should be done to prepare a patient for exercise stress test? Don't eat or drink anything except for water for 4 hours before the test. Don't eat or drink anything with caffeine for 12 hours before the test. Don't take the following heart medications on the day of your test unless the doctor tells you to do so. Otherwise, the medication is needed to treat chest discomfort the day of the test. Like examples, isosorbide dinitrate, isosorbide mononitrate, and nitroglycerin. And if you use an inhaler for breathing, bring it to the test. What should you wear on the day of your stress test? Wear soft-soled shoes suitable for walking and comfortable clothes, and don't bring valuables that are not necessary. Procedure: the patient is connected to ECG monitor on the treadmill. Check baseline blood pressure and 12-lead ECG. When you start the treadmill, monitor the patient's symptoms. Check blood pressure every 3 minutes. Treadmill ECG machine records 12-lead ECG periodically. This is a picture to demonstrate the patient on the treadmill. Here you can see the technician, the ECG monitor, where the electrodes are placed, the blood pressure curve, the handrail, the slope, which can be verified in the treadmill. Here is also another picture showing the same, the electrode attached to chest, the electrode connected to the machine, the patient walking on the treadmill. These are absolute contraindications, which include acute myocardial infarction, unstable angina, uncontrolled cardiac arrhythmias, symptomatic severe aortic stenosis, uncontrolled symptomatic heart failure, acute myocarditis, acute aortic dissection. Relative contraindications: left main coronary stenosis, moderate stenotic valvular heart disease, severe arterial hypertension, tachyarrhythmias or bradyarrhythmias, mental or physical impairment leading to an inability to exercise adequately, high degree atrioventricular block. Thank you.